Well, today's Debunking the Myth deals with taking supplements. And you know, many physicians tell their patients that taking supplements just gives them expensive urine. Well, Joe has the facts to debunk that myth. And I mentioned vitamin C before the break. You know, that's one of the things that we hear a lot about. But doctors just, you know, aren't always really on board with taking vitamins. Is it a myth that taking all those vitamins? I think I know the answer to that.
Any physician that would make the comment that taking vitamins just gives you expensive urine, my guess is that if I had even a 5 or 10 minute conversation with that individual, I would be able to quickly dispel that notion, even with their agreement. Because I would ask the thing that they always comment on. The first thing they always comment on is what scientific evidence, you know, do you see of that? If they were to say, well, we see that when people take supplements, there's more vitamins in their urine, so therefore you're not utilizing it. That's not you know, congruous evidence mounting there. The other thing is, Shirley, and this is not meant to be critical or divisive to the medical community, but and this is changing as well. But most physicians have a total of 4 hours of nutritional training. Through school. I think
that is changing a little bit, thank goodness.
So, you know, many of the physicians that I've had involved in my life, you know, they were brilliant in the area that they were working with. You know, and I had this with my child, but, you know, as far as nutrition goes, I was more well-informed than they were. So, exactly. So that is indeed a myth. So just like the RDA, the recommended daily allowance.
Yeah, let's talk about that for a minute, because, you know, people think okay, well, if I'm getting the RDA, then I'm okay.
If you're getting the recommended daily allowance, those daily allowances should have been daily minimums to stay alive. That would be kind of a long acronym. But for instance, they came up with the vitamin C one from what does it take to prevent scurvy. The vitamin D RDA came from what does it take to prevent rickets. So minimal. Absolutely. So, you know, we like to think in terms of optimal daily allowance, you know, my own acronym of ODA, you know, optimal daily allowance. Okay. And for instance, the recommended daily allowance for vitamin C is 60 milligrams. 500 milligrams to 1,000 milligrams, depending on whether you work out or not, would be a much better dose, a much more effective dose of vitamin C. Vitamin D, which we touched on in the first segment, has a RDA of 400 IU. And they always said that, you know, that's fat soluble, yes. Yeah, and now they have studies, Shirley, showing 2,000 IU a day consistently.
Wow. With D?
Yes. Wow. And still their blood levels in the low 40s, which is nowhere near the toxic level. I wouldn't recommend people to supplement 2,000. We're not saying that. No. But certainly 400 RDA 400 IU is not they're going to be therapeutic in any way. It's strictly that baseline to kind of survive. Like a total minimum. Right.
Yeah, okay. Well, in our email bank, we got a note from Linda in New York, and she writes, even after all the negative data about hormone replacement therapy, some doctors are still prescribing it in smaller doses. Is there any situation where the benefits of HRT do outweigh the risks? And, you know, that's a very good question for our resident MD, Dr. Walt Larimore. So let's see what he had to say to that question.
Well, you're right. There was a great deal of negative PR about hormone replacement therapy, or what's called hormone therapy for menopause, a few years back. But we've learned since then that most of that negative PR was because that very large national study was done with older women. What we've learned since is, although hormone therapy does have significant negatives in older women, with younger women, 50, 55, who are going through menopause and suffering from those severe symptoms, that low levels of hormone therapy for as short a time as possible, 6 months to a year, in most women has more benefit than risk. Is there risk? Yes, there's risk to any therapy, and you should know what those risks are. But I think our job as doctors and patients is to weigh the benefit-risk ratio. What are our options of therapies? What's the benefit? What's the risk? What's the upside? What's the downside? What's the cost? And with that information, we can make a wise decision.
Well, he's one of the few doctors who really see the benefit, and but like you said, more and more doctors are coming around and they're realizing that.
Yeah, sure. I think HRT has been one of the disasters of modern medicine.
Gosh.
I really do.
I feel like I was lied to. I was deceived.
I would recommend almost any treatment option before that. Well, listen, for a copy of the show, today's show, call 888-242-9393. Coming up, the amount of supplements you hear about and see in the store could scare you away from taking any altogether. But after the break, we are going to answer the questions you sent in on supplements. Stay tuned for your answers.